Good evening to all of you. I'm Dr. Sheila. I will be with you for our paper Biostatistics. This paper is mainly about how to do research, yeah, how to do research in a proper way, and what is your contribution from the research. So, what is the benefit of doing the research? So, for our 10 classes here, follow the schedule. I will be teaching you on a proper way to do a research. Okay, so today's class is just going to be a recorded video, and I will be talking about ethics. Yeah, ethics in doing a research. What are the do's and don'ts in a research? All right. Um, cause you have come across a lot of research you have read, yeah, researchers doing research, yeah, and your research is basically going to be with your patients. You're going to do your research with your patients. So let's see what are the do's and don'ts in a research. All right. So today's lesson is about understanding the basic of dental research. So we are focusing on our basic of dental research. After following the class, you should know what is research and what is the flow of the research protocol. What are the steps that you need to take when you are doing a research, and to know the ethical issue arises before starting the research flow. I mean, you must know what you are doing before you start. You cannot like no turn back lah. You can say, oh, I don't know. Oh no, I do wrongly. I want to start back again. No, you can't do that because you're wasting the your patient's time. You should learn to respect their time, right? All right. So let's see what is ethic, what is research, how they are combined together. uh, Ethics, is a way of life. Yeah, ethics, that means we have some principle in our life that we need to follow, that is called ethic. So how does this ethic fit in our research? What is exactly research ethics? So research itself, they have their own ethics. So, research ethics are moral principles that guide researchers to conduct and report research. So, whatever your outcome of your finding, you must report according to what you get. You cannot simply add stories or make it more dramatic. Yeah, you can't do that. Yeah, because that will harm. That will harm another person. Yeah. So, intention to harm the participant of the study, make sure that you don't harm your patients, yeah, or members of the society as a whole, whether knowing or unknowingly. So in which way you can harm a patient? Just think and see, how do you harm a patient by doing a research? Maybe by asking a sensitive question, or you're not taking care of the well-being of the patient. For example, you want to test how good is this painkiller. So you get two set of patient. One patient you give painkiller, another patient you don't give painkiller. That is you're harming the patient. You are not giving the equal right to two group of your studies. That comes under an ethical kind of attitude. Yeah. So research ethic involve of the application of the fundamental ethic principle to research activity, which include design. The design you do, the design of the experiment or the implementation must not bring any issues. You must give respect towards society and others, use the resources and research output, scientific misconduct, and regulation of the research. So that is the application. I understand that this paper does not have any exam, but there is a what you have to produce a research paper. Yeah. So from my experience, doing research, doing research, um, it's not very difficult, but you need to be very careful, especially when you plan your research. Because as I told you here, time factor, you are given certain period of time. Yeah. So if you plan your research wrongly, your outcome is not valid. Yeah, it's not valid. So I quote you an example. There was once a researcher wanted to study about um, private hospitals in Malaysia. Yeah, private hospital in Malaysia. You want to find out about the management. Management. So her sample was the patients, and these patients are ill, very ill patient. Yeah, they're very sick patient. So this researcher, she planned such a way that she wants to get the data from the patient, from the patient, not from the family members, yeah, from the patient itself. So she took the data and she managed to collect. It took her almost 3 years because she wanted to. She's for a PhD, so she has to go around Malaysia to find the samples with all the private hospital. And then when she presented the case, her proposal was rejected. Why rejected? Firstly, she did not take consent from the patient. And these patients are very critically ill. So whatever comes out from them is not valid because they are under very strong medication. Sometimes they don't know what they're talking. So here you can see that she did not respect or did not give privilege respect lah, more of respect to the patient. And these patients, they need a proper rest. This is not time to go and do a research. So that's why her paper was rejected. Yeah. Uh, so we have to look at the ethics. Yeah. Why is it important? Yeah, important of ethics in research because it gives the researcher from committing errors. Yeah, you cannot commit errors while seeking knowledge and truth. See, like this case, she made an error. Yeah, it promotes essential value that help researcher working on a topic to have a common understanding on how things should go about. So it will give you some picture, yeah, a picture that when all these are taken care. Yeah, I give you another example. uh, a person, he went to UK to study. Yeah, he went to study in education line. Yeah, in education line. So when this person went to UK, the last day everything was over. He was a teacher there. Yeah, teachers doing practical teaching there. So the last day he wanted to take pictures with the students. That's what we always do, right? The last day of class, we always take picture with the teacher. But that time we don't have social media to upload, so he did not upload anything. Yeah. But after taking the photo, these children told their parents that they took photo in the classroom. So these parents got annoyed. Yeah, they were not happy. So they came and they confronted the teacher. He said, "You did not give us any consent letter that you want to take photo. You can't do that." Yeah? So it became an issue. Yeah. So here we have different culture. In Malaysia, it's different. When the teacher want to take picture with the student, they are very happy. Everyone wants to take photo, and you go back and tell your parents it's not an issue taking photo, unless you use the photo in a wrong way. That is mis. But this case, uh, the culture is different. So you need to you have to respect the culture. So there is an ethics here. All right. During my research, I was doing my research on green chemistry. Green chemistry. In the questionnaire, this questionnaire were adapted from overseas. So they say if the citizen is not happy, they will do demonstration. Okay, demonstration in Malaysia, we don't do demonstration if you're not happy, right? So then the culture is different. So in my questionnaire, I cannot say that I will do demonstration if I'm not happy with the policy of the government. Straight, I will go jail, correct? So here we have, whenever we do a research, we must look at our culture, right? Our culture. So whether it works or not. Okay. Or you want to talk about diet. Yeah, you want to talk about diet, and you want to do a research about diet. Eating more vegetable or eating meat is better. So when you find your sample, you cannot go and find a vegetarian to do your sampling, cannot. So you have to respect their religious belief. So in our country, religion is one of the important factor. Yeah, if you take Asian countries. So if you talk anything about religion, they get annoyed. So here, ethics, you must take care all this. Okay, and privacy. Privacy. In If in a Western country, you cannot simply walk into a house. You have to make an appointment because they have a privacy. Yeah. Uh, or a student. Yeah, you are doing a research with student. You need to also give them the privacy. They have time. They need to time to rest. They need time to eat. So all these are considered as you must be fair. Yeah. Values, you must give cooperation, you must do coordination, you must give mutual respect. All these are very important in research. All right, so we have three types of ethics here: meta ethics, normative ethics, and applied ethics. Your focus here is more on applied ethics because you are doing a study on biomedical. Yeah, you're doing under biomedical. Now, what do you call a research, whether it's scientific or not scientific? Okay, give you an example. A person who sells medicine, yeah, medicine at the roadside, medicine at the roadside. So when the person want to sell medicine, I'm not telling it's wrong. Yeah, I'm just telling you an example. He sells like all this ubat lah, all this medicine where you want to rub on your hand when your hand is pain. Yeah. This kind of medicine, definitely, he would not have got undergone all this scientific research. It's not scientific. That means what is not scientific, he do not have any proper data to support. Maybe you would have just taken photo of some person, maybe his hand swell after rubbing this, the swell went down. That are only few evidence. He did not collect a proper scientific research. So when you have a scientific research, what can you do with the scientific research? You can generalize. So if it can happen in your place, yeah, the extent to which the sample used in the research project reflects the broader population of interest. So whatever you get your finding, you must be able to generalize. If not your finding, you cannot apply anywhere. You can only say, oh, in PIDC only it works. In other place, it does not work. So when it's a scientific research, if it can work at your place, it should work everywhere in Malaysia. So that's why your research is only scientific if you can generalize. All right. Uh, um, if, for example, you take all the private colleges, dental private colleges, and then you do a comparative study with the government or public dental colleges. Yeah. So whatever you find in your private, if you can be able to generalize to the public college, then it is called as, you can generalize, and it is a scientific research. All right. Um, Research, another one, is very objective. Yeah, it's universal. Research should be designed in a manner that allows any competent research to conduct a similar study and generate the same finding. The third one, it must be original, original work. Of course, you cannot. You are given a very short period of time. Of course, you cannot come up with one original work because it will take a very long time to get the original research. But original ideas backed up with appropriate evidence in a clear, logical, convincing argument that illustrate critical and analytical thinking. So if it's a scientific research, you must have a originality. That means somebody have done it. Yeah, but not 100% has what they have done it. You must add a new element into your research. Yeah, enter a new element to your research. So let's say you say coffee stains the or coffee stains the color of the teeth. Many people have done it. They say coffee, yes. So what is the originality? You must add something into the research to show that is your original idea. Other people have done it. I already know the research. Why should I read your research? What is it so different from others? Yeah. But don't take something out of nowhere. Then you will have a problem looking for literature review. Choose something that others have done it. Maybe they have done it in overseas. You want to try in Malaysian culture. Yes, you can do that. All right. Scientific rigor. Truth is accepted if there is sufficient evidence. Evidence is very important. Whatever evidence, it should direct you to the objective or the outcome of your study. Yeah. So if the person want to repeat it elsewhere, they will get the same result because it's scientific. All right. So, what I can say about research ethic is a code of guidelines lah, how to conduct a research in an accepted way. Morally, it is correct. Yeah, and principle and standard that help researcher to uphold the value and standards of knowledge construction. So ethical consideration in the research process. We have 6 stages of research. Yeah. So in this research, when you design the study, it must be ethical. Um, when you recruit participant, also you must uh, consider the ethic. That is, they have their privacy. So if the participant say, no, I don't want to take part in your research, I'm not interested, you cannot force. You cannot force. Or you cannot take underprivileged or what you can call as underprivileged lah, yeah, or the challenged group. You cannot, yeah. Uh, and then during the intervention or measurement procedure, the participant are subjected. You must take care your sample, your patients, because sometimes the study is very long. They will get bored or they will lose interest, and they feel they don't benefit from the study, so you have to let them go. Yeah. And also you have a management of risk. If you're doing a intervention which will be risky for them, you choose the group that they already have illness, then you make it severe by your intervention, so you need to consider ethics in that. And then once you get results, yeah, it must be confidential. That's why counseling in Malaysian school does not work. You know why it does not work? No confidential. The student go and tell the problem to the counselor. After few days, the whole school knows about the girl's problem. So that is not confident. Yeah. So if you collect the data, the patient tell you that the person is a diabetes, the patient has high blood pressure, the patient has HIV. So all these, uh, you are going to collect data, but you must not. That's why when you collect the data, normally we don't ask them to write their name. We just label them as sample one, sample two, sample three. We don't ask for their name because we want to respect their privacy. Yeah, and after you get the result, the outcome, you must make sure that the community must benefit. Okay, like here you are collecting the data from all the Butterworth people who comes to your clinic. So what is your contribution? They came, you do research with them. What is the contribution towards the, of course you cannot, maybe you cannot contribute to your sample, but what is your contribution to the community? You realize that they don't have proper oral hygiene. You know that all the patients come from Butterworth, they don't have oral hygiene, proper way of doing it. So how you are going to contribute? You can have a exhibition to show, maybe in a shopping complex to show that this is a proper way of oral hygiene. Or you go to the school, the coming generation, you want to educate them to create awareness. So you go and teach them, this small children, what is the proper way of brushing their teeth or taking care of their oral hygiene. So make sure you have a contribution back. Yeah. All right. Now, just now we talk about the ethic. What is unethical? What is wrong? A study can go wrong. Yeah. You never tell them why you are doing the research because you scared after tell them they won't take part. So you're withholding information about your study. Or you bluff them, you don't tell them the truth, misleading. Yeah, misleading. uh, if the patient has a heart attack, yeah, it's a heart patient, sometimes it will be very risky to withhold information. Yeah. Plagiarism, you take other people's idea, you claim that's yours. That is plagiarism, cheating. Yeah, cheating. The copyright of others. Even copyright of idea also consider plagiarism. That means, I say I you heard a story from your friend. The friend is going to do this kind of research. So before the student do the research, you already started your research. You took all his ideas. That is called plagiarism also. Yeah, stealing people's idea. And then conducting a research but no scientific base. Simply do because I feel this is the case, so I want to do. No, you must always have a read up first. Yeah, read up. Mostly here, I think the topic will be given by your supervisor. Yeah, so you need to read up the the scientific, yeah, scientific, like a problem statement. You say there is a problem. What is the problem? You say that what kind of problem you can talk about your dental, what problem you want to study in your in your dental. So you came up with a problem. It must have a scientific base. Yeah, people who are diabetic have higher chance to get tooth decay. Maybe from your observation, you think like that. Do they have any scientific evidence that if a patient is a diabetic for 5 years, they are most likely to get a tooth decay? Yeah. Last time there was a study, done by, I think this is under prisoners lah. Yeah, they want to say that certain face structure, they will end up as a criminal. Yeah, this kind of face structure definitely will be a criminal. So, is there any scientific evidence showing that? Huh? Uh, so in dental also like that. Whatever research you do, you must have a scientific backup. Yeah. A lack of objectivity, integrity in the design and conduct of the research. So it's the design that you do is not integrity. Yeah. The design maybe you do is very biased. Yeah. You are not looking at the methodology correctly, not valid. The findings are not valid. You never measure what you are supposed to measure. You measure something else, so no valid, not valid. Misinterpretation of result, you simply add stories to your result so that it looks very convincing. This happens a lot. Yeah, manipulation of results. um, like hypermarket, they say they made a lot of sales. Why they made a lot of sales? Because these are the criteria. Yeah, so they want to market their, they want to show that their market is very popular, so they will try to manipulate the result. That is bad, that is unethical. um, Not providing detail of the theory or method that be relevant of the interpretation of research finding. This is very common. No theory behind it. Fabrication or falsification of data. The data, not enough data, they simply put in numbers just to show that that is the data. That is blah blah. Fabrication make the data look very nice. But if it's a real statistician, they will know that whether you cheat or you, there's a real data. Yeah. All right. Not following the appropriate authorship to the publication. Three of you did the research. Yeah. And then when you want to publish, you simply put another person name because the person is very popular, will be easily to be published. So you're not following the appropriate way, yeah, of authorship to the publication. Not respecting the right to privacy, not respecting confidentiality, not respecting the right of the vulnerable group like children, mentally handicapped individuals. Yeah, uh, you you do that for your own interest. Yeah. Okay. The age, the prisoners, the illiterate with the and those with low social status. Yeah, low social status. Okay, anything you need to clarify, you can ask me. All right. And you're not respecting the environment. So fundamentally, research ethics are a way of conducting research such a way that you have respect, you do justice, yeah, to your research, um, and you must confront with the national and international accords, right? Okay, so these are the principles of research ethics. You cannot put a risk at one group and benefit another group. So if you have two groups, you want to compare the intervention between the two groups. So when you want to compare the intervention between the two groups, yeah, so when you want to compare the two, so you cannot be biased towards one group. One more group, you make them the worst, right? Because you, whatever research you want to show that the intervention group perform better than the control group. You cannot do that. Yeah. You must respect for the research participant, respect from the sponsor of the research, respect of communities where the participant come from, and respect the knowledge and the academic community, right? So this one you can read on your own. Okay, so now we have two branch of research. One is called as clinical, one is called as social science research. All right, so what is the difference? We look at the social science research. Social science research, normally you want to um, study the behavior. Most of the time it's behavior of a person. Social science research, a lot you will see in psychology. In fact, I can tell you that research started in the psychology aspect. Okay. Uh, so here you will have a systematic recording and analysis of data that may lead to generalization, principle, and theories resulting in prediction. Social science, you can always do prediction, yeah, and behavior and events in the society. All right. And then social science research, you will do a lot of review of literature, review of data, interviews, you have focus group, you have observation, you have instrument. All this I will explain later, yeah, in other classes, yeah. And you have 8 phases, depends on your research question and the design of the study. So yours is actually, you have a bit of social science research and also a clinical research, yeah. Clinical research that you do, I'm not very sure how much you're involving medicine, yeah. All right, a study intended to test the safety, the quality, the effectiveness of new or existing or old medicine, yeah, treatment, and most of the time it will be human. But social sciences, it can be more on device also. For example, teaching online improve the performance of students. So here I'm looking at the online, the process of teaching. But most of the time, your clinical research will be dealing with human. Yeah. All right. Research activities. Research activities, you have procedure, maybe surgical intervention, removal of body tissue, fluids, yeah, or even you study about the X-rays, yeah, the record, yeah, and then questions, all that come under your, what kind of activity you do to get your results, yeah. And you have 4 phases. Like social sciences, you have more phases, 8 phases. Yeah. So when social sciences, you will identify the problem. What is the problem? Looking for problem itself will take you months. You must look what is the problem. Can I do a research on the problem? When I do the research of the problem, is it benefit? Does it benefit anyone? My research? Yeah. Uh, if it's not benefit, then no point of doing the research. Someone must get a benefit. That's why a person who does research, they are given a PhD and they are given a recognition of doctorate because the contribution of their study. Like my study was in green chemistry. So green chemistry means my study, my PhD was in green chemistry. I'm a chemistry person. So I invented experiments where students use chemicals which are not harmful to the environment. So that is my contribution to the chemistry field. Yeah. So I have few experiments that the student do which will not harm the earth. So what was my problem? My problem that um, the problem is whenever I say I'm teaching chemistry, oh, people say, oh, explode, things will explode. So they have already have the idea that chemistry, they are harmful to the environment. So I know there is a problem. Chemical that we use, we are actually killing the mother nature. Yeah, we are killing the uh, what do you call that? All the living creatures in the ocean. So how? What is the problem? That is my problem. So how do I overcome the problem? So I must have a theory saying that when I use green chemistry, I'm protecting the environment. I must have a theory behind that. So it's a development of the theory. Then my hypothesis: when I use green chemistry, I'm saving the environment. That is my hypothesis. Correct? Well, how I know I'm saving? So I have a backup from my literature review. Then I design. What I design all the experiment that I do must use green chemistry. All the chemical must come from nature. Yeah, come from nature. So that is my um, research design. So I get groups of students who are using green chemistry and one group is not using green chemistry. And then I also find out how much knowledge the student have when they do green chemistry experiment. And the student who do not do green chemistry experiment, how much they know about the nature. So I must design such a way that I will get my result. I must use the proper instrument. Then I collect the data. Once I collect the data, I analyze. That is the best part. Phase 7, analyze the data. Do I get what I expect? Do my outcome, yeah, answer my questions? Ah, then after that, I do the report writing. And then I share my findings with others. That is important. Communication. I communicate and so that the coming batch will benefit from my study. That is what I can tell you a lot about social research. Okay, so yours is phase 1. You might use a drug or vaccine. You will test it in a small group. Yeah, to determine the correct dosage, the negative side effect. Then you go to phase 2. Then you do a clinical trial with more groups. Then you get a bigger group. All right. Uh, then that is how you do your clinical trials. Yeah. Okay. Next one. So this one is an example lah. Yeah. That how the participant refer to the studies. All right. Why are we so concerned about research ethic? Is a professional. We are doing professional kind of job, so we have professional responsibility. We don't want to damage our reputation. Yeah, we don't want to be harmful to the participant, the researcher, the institute, or the research community. Don't want to give a bad name. Yeah, that's why when we do, especially like education, yeah, you want to do a research about the school, like say you want to talk about gangsterism, yeah, gangsterism. You want to talk about the gangsterism, we will not mention the name of the school because it's going to give a bad reputation about the school. Okay, or we do about burnout among doctors, burnout, yeah. So we won't mention the hospital which we do the study because it will be harmful. Yeah. So normally we will just say public hospital, where and all that. We will not give the name. Yeah? Even when you collect your data, your patients must not write their name. Right? Okay. Ethical issue, a lot of ethical issues will come in the field of stem cell research, where we have clones, yeah, clones of what, the Barbie, not Barbie, Dolly, sorry, Dolly, yeah, where you get another, using the stem cell, you getting another animal, yeah. Even they were talking about human, yeah, doing cloning the human, yeah. So you can read up on that. And these are the principles of dental ethics, yeah, that you all have. So this one you can just look at it. Okay, now I'm going to just talk a little bit about the progress in dental research. You see, 1926 itself, yeah, they already had the foundation, yeah, to to give dental education, yeah, started in United States and Western Europe. Then 1930s, fluoride, the benefit of fluoride, yeah, what is the benefit of fluoride was discovered. And 1937, they found out about the dental screw implant, inserted by Elvin Sprock, first dental screw implant. And then in 40s, clinical trials were invented. I'm sure you all know about all these, about drinking, yeah, drinking fluoride water. 1945, fluorination of water began. That means they start adding fluorine to water because they believe that it will improve on their bones, yeah. Okay. And then we had federal funding for dental research was established. 1949, adhesive bonding and polymer chemistry were developed. 1955, a simple method to increase the adhesion of the filling to the enamel. I'm sure all this you will ring better to you than myself. Um, and then also after that, 1957 was about commercial success. And 1962, BIS GMA. 1965, first dental implant. All the terms you are more familiar with. And then 1995, major call for reform in the dental education and practice of dentistry. And so on lah. So this is until then. Okay, why do we do research in dental? Of course, for promotion of health, risk assessment, disease prevention, treatment, what are the best treatment, therapeutics, and then resource safe materials, and predictable clinical outcome. So we are developing new approaches to solve problem and how you can improve your treatment. So these are a lot of improvement. You see the scenario just now, yeah, year by year how it improved, right? So these are the ethic policies that came up lah throughout the years. Yeah, it started in 1965, and it's still we are still adding one by one. Yeah. So remember, whenever you take your patient as samples, you must always get the consent form from them. They must agree and they must know about the risks and the benefit of the study. Yeah. And you must be very uh, what you call that, transparent. You must tell them, don't force them. Yeah. Don't influence them to take part in your study. Yeah. Normally Malaysians, they are very obliging people. They will offer themselves. Yeah. And then you must tell them lah, why are you doing the study? Yeah. Tell them the truth. Yeah. Why are you doing the study? Stages of consent. You must here you see the word pilot testing. Pilot testing means before you do with a big group of people, you just take a small number of people, do the study first. If everything okay, then only you extend it to a bigger group. Yeah. Stages lah. Before the commencement of the study, do pilot. Okay. At the beginning of the study, you must talk about the risk and the benefit of the study. Understanding is assessed. During the study, address the issue concern. Yeah. In Western country, ethics are very important. Yeah, they have their rights. Yeah, they have the rights. So you must let them know. In Malaysia, also same. Now people are more aware of their rights. Yeah. So when you are doing your proposal, the committee will look into the ethics also lah. So they might just ask you what are the ethics, yeah, that you considered. Yeah. So you must respect the dignity of the participant. There is a privacy, benefit and risk, sampling. Are you fair to the participant? Yeah. And then the protocol. Yeah, that you need to follow. So this is about the ethics in research. So I will be uploading more materials in the Google Classroom on how to do references and all that. If you have anything, you can come back to me. You can ask me. Yeah, anything if you have to ask. All right. Okay, so I think that's all for today's class. For my next lesson, if it's possible, I will try to come online. All right, and we will do face to face, not face to face, like online. Yeah, we online kind of teaching. Okay, I will keep informing Kevin, yeah, your class rep. All right, class. So thank you very much. I will see you all next lesson. Good night. Uh, got